we have a very special guest, a Medicare expert, Luann Yarberry from Higginbotham, and she has joined us to help answer some questions that you might have. So make sure that you write those questions in there. We will get them asked and answered, as well as educate us all. I know I've been in HR for a long time, but Medicare is not my strong suit, so I'm very excited to talk with her. So if we can welcome her. What is Medicare? Is it the same as insurance, like group insurance, or is it something different? Is it similar to Medicaid, which I understand Medicaid is for younger children? So what is Medicare and how is that helpful to people?
Sure, excellent question. So basically, Medicare is primarily for folks that are 65 and over. If you're under age 65, you can apply for Medicare through Social Security disability. So if you're disabled for 2 years, you are eligible for Medicare at that time. The majority of the people that enroll in Medicare are those folks that are turning 65. One of the things that a lot of people get confused about is Social Security and Medicare. A lot of people think they have to enroll in Social Security in order to enroll in Medicare, and that's just certainly not true. You can enroll in Medicare when you turn 65. The Medicare program was set up through the federal government. It was set up to help those folks, again, that turn 65, back in the have group insurance. And so that was one of the issues, and that was one of the reasons that that Medicare came into place, was really to help those people that had no other coverage when they were turning 65. A lot of folks that are scared of Medicare is mainly because they might have been on a group policy or an individual policy, and it's kind of what they know. In other words, they just don't want to make a change. But what I can tell you is, as long as you reach out to your providers, you confirm that your providers do accept Medicare. Most of the people that sign up for Medicare, once they jump into this, they absolutely love it, because more than likely it's going to be less expensive than what they're paying on the individual market or what they're paying on the group market. And so let me kind of break it down a little bit about how Medicare works. There's actually 4 parts to Medicare. Medicare Part A is an apple, that's your hospitalization part. That is what you have paid into all of your working years. So if you work for an employer that does payroll deductions for you, you're going to see a deduction that says Medicare. Well, that's Medicare Part A. So I tell people, when you turn 65, you are eligible for Medicare Part A because you have prepaid for it. A lot of folks will say Medicare Part A is free. Well, we should all know the government's not going to give us anything for free. You have actually prepaid for Medicare. Medicare Part B, think about it this way. It's kind of everything outside the hospital. It's going to be your doctor's office visits, your lab work, your x-rays, MRIs, CAT scans, all of those things that are kind of outside the hospital. Then we have Medicare Part C. So Medicare Part C is called the Medicare Advantage Plan. If anybody has turned on the TV within the last 2 weeks, you have probably seen Joe Namath. You've seen a lot of these folks on TV talking about Medicare, talking about how you want to enroll in Medicare. Well, those are Medicare Advantage plans. Medicare Advantage plans replace Medicare. Think of a Medicare Advantage plan kind of like a group health plan. It's going to be the primary payer of all of your claims. So these tend to be more like an HMO plan, though. They tend to be restrictive on the network providers that you can go see. You just need to be real careful when you enroll in a Medicare Advantage plan, because again, these plans replace Medicare. They certainly have a place. They are they kind of package everything together. They package your Part A, your Part B, some supplemental coverage that we'll get into in a little bit, dental discounts, vision discounts, hearing discounts, gym memberships. So again, kind of think of the Advantage plan kind of like a package. It's going to roll everything into one. And then the very last part of the Medicare is Medicare Part D. D is in drugs. This is what covers your prescription drugs, because Medicare Part A, Medicare Part B, which we call traditional Medicare, it doesn't cover drugs. So you have to get the Part D, which is the drug card.
Do you have to sign up for Medicare? I mean, is that something that people should do, or does it really matter?
Well, it's kind of like I was telling you about the Medicare Part A. You have prepaid for that. So I tell people it is like leaving money on the table if you do not sign up for Part A when you turn 65, because you have prepaid for Part A. So, Social Security is the division of the federal government that administers Medicare. If you do not know if you have paid in enough to Medicare, so what does that mean? If you've worked 10 years or 40 quarters in your lifetime, and the reason that I say 40 quarters is because you may have worked for 2 months, you have may work for 3 years, taken a year off. So they break it down into quarters. So if you've worked, again, 10 years equates to 40 quarters, you have prepaid for that Medicare Part A. And so, again, sign up for A if you don't do anything else. But you don't have to sign up for Part B. If you have group insurance, you more than likely don't want to sign up for Part B, because you will have to pay a premium for Part B, and Part B is based upon your income. The base amount for Part B is $148.50. So if you compare what you're paying on a group policy, on an individual policy, Medicare Part A, remember, is at zero cost if you've paid in enough quarters. Your Medicare Part B is $148.50.
Is that per
So
month?
it's all about a personal choice. Do you want to keep the group health plan? Do you want to move on to Medicare? It's all about kind of doing the math.
Is that the 148.50? Is that per month, or is that how do they break that down?
Sure, $148.50 is per month. And again, that's the base amount. So there's a chart on the Medicare website, on the Social Security website. It will kind of break down your income, and it will show you how much you actually are going to pay for your Part A. If you're in a super high income level, you may pay upwards of $500 a month for the Medicare Part B. But again, base is $148.50, could go all the way up to $500. But you have to be in a super high income level to pay that high amount of the $500. Great. We've got a chart here, which is really kind of helpful here. If you notice on here, hopefully everybody can see it, it's based upon how you make your tax filing. So if you filed single or you filed married, that's what's going to be what they look at. So let's say that I'm going to apply for Medicare in 2021. They're going to go back 2 years, look at my 2019 tax return. So again, let's say that I am married filing jointly. Our combined income is $176,000. We're going to pay $148.50. So I'll give everybody a few minutes to take a look at that chart. And then let's say that we're single and we make, we're single and we make, let's just pick the one, let's just go back to the 88,000 or less. So if we make 88,000 or less, we're still going to be in that 148.50. Let's kind of jump around on this chart a little bit. Let's say that you're a married couple and you file your taxes married filing jointly, and your income is $250,000. So if you notice on this chart, the $250,000, you're going to pay a premium of $297. So again, Dylan, great chart. Thanks for pulling this up. This kind of gives people an idea of about how much it's going to cost based upon their income.
I am going to retire, and I'm looking at choices. I can stay on my group plan through Cobra, or I am deciding if I should go for the Part B in Medicare. Mm-hmm. What would you suggest for those people?
That's actually a great question. I'm so glad that you asked that, because one of the pitfalls of Medicare is they do not recognize COBRA as credible coverage.
Oh.
So we all kind of know that COBRA is the exact same insurance that you have when you're a working active employee. However, the key word there is active. When you go on to COBRA, you are no longer an active employee. So Medicare does not recognize COBRA as credible coverage. And that means that you will start incurring a penalty for delaying your enrollment in Medicare if you do not move directly from your group onto Medicare. So it's all about doing the math. I tell people it's a personal choice, but truly is about doing the math. So you calculate in what is the group coverage costing you and what is your exposure for your out of pocket. So for instance, I'm going to make up some numbers here. Let's say the group plan's costing you $12,000 a year, $1,000 a month. Your out of pocket exposure, let's say you go into the hospital, that's maybe $5,000. Okay, so we take the total amount of the premium, we take our out of pocket exposure, we add those two together, and that's what our exposure is under the group plan. Then we look at Medicare. We say, okay, Medicare Part A is a zero amount. We say that Medicare Part B, the B is in boy, that is, again, based on the income. We look at the income chart. We figure out what that cost is. Then we determine what is going to be the cost, what I call the supplemental part of it. Supplemental part is going to be, do we buy a Medicare supplement? Do we buy a Medicare Advantage plan? And then, of course, the drug plan. I'm going to tell you all in with Medicare, if you're on, say, that $148.50, that base amount for Medicare, all in is going to cost you somewhere around $300 a month.
But what happens if you want to go to Medicare, but your group plan also covers your family? What happens to their coverage?
Yes. So in that situation, you would want to stay on the group health plan. The reason you want to stay on the group health plan is because literally you leave your family out in the cold if you drop the group insurance, because you are the employee and you're the one that is eligible for the coverage in order to coverage the dependents. So if you hop off the group, then the dependents can't stay on the group without you.
Right.
Does that kind of make sense?
It makes total sense.
So open enrollment for Medicare when you're turning 65 is a 7-month window. You have 3 months before the month of your birthday. You have the month of your birthday, and then you have 3 months after your birthday. So it's called your 7-month open enrollment window. And, one of the things that having the relationship with Higginbotham that we can help you with is, part of my job is to help educate those folks turning age 65. It's not necessary to sell them anything. That's not what we're here for. It is strictly to say, what is your situation? What can we do to help you make a more informed decision? Again, good questions like, I've got my family on the plan. Then you need to stay on the plan. I'm turning 65. Do I want to enroll in COBRA? My group plan, I've already met my deductible. I'd like to stay on my group health plan. All of those types of factors, we have to talk through that. Mm-hmm. So that the folks, again, make that informed decision, because Medicare is kind of scary for a lot of people. They know what they're used to. They want to keep what they're used to. But again, at the end of the day, do the math. It may not be the best route for you to go, because Medicare may be saving you a lot of money if you move over to Medicare.
How do they sign up? Because we get a bunch of stuff in the mail. Like, what would be the best route to sign up for Medicare if you've decided, you've done the math, and you're going to sign up for Medicare?
Yeah, the easiest way to sign up now is on the Medicare website. It's medicare.gov, G-O-V. That website has a link that actually helps you to apply for Medicare. And again, remember, Social Security is the agency through the federal government that actually signs you up for Medicare. But on the Medicare website is a much easier link than trying to go to the Social Security website and get all confused. Am I signing up for Social Security? What am I signing up for? So that Medicare website is the best way to do it. Some of the smaller Social Security offices are still open, again, due to COVID, but you might, if you have more questions about, should I enroll in Social Security and Medicare? So you might want to set up an appointment with your local Social Security office, and they are more than happy to help you also get signed up.
Is there any other tips that you think that would be helpful for our drivers or employees who are either already 65 or they're coming up on 65 that you think would be the one takeaway they should do?
Yeah, so this time of year, just be extremely careful because there's a lot of misinformation. There's a lot of things that come in the mail, phone calls, TV ads, radio ads that talk about signing up for Medicare. They are specifically trying to direct you into the Medicare Advantage plans. Most of these plans have a limited network of providers that you can see. So just be very cautious about some of the information that's out there. Reach out again to your HR department, reach out to somebody like myself. They can make sure you're making that informed decision, not something that's somebody's telling you you can get Medicare for free or this plan for free, because we should all know nothing's for free.
Right.
And it will definitely have a probably very limited network.
Well, I really appreciate you joining, Luann. It was so helpful for me. I know it's going to be helpful for our employees that were watching, and I just appreciate the time. I know you're super busy, so thank you so much for joining us.
Absolutely. Happy to be here. Thank you so much.
Thank you. And thank you all for being here. We really appreciate you joining us every Thursday here on the Lowdown with Sheli Brown, and we'll see you next week.